Hello and welcome to On Call After Hours, where we answer the questions we didn't get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So here we go. Mike Pietila from Yankton, pulmonologist, internist.
Yes.
A pulmonary internist.
There you go.
And here we have from Sioux Falls, her 50-year-old has asthma and is diabetic. Was on albuterol, switched to Advair, and gained weight. Is it related to the Advair, or is that coincidental?
I think it's probably coincidental. There's not enough steroid in the Advair that I'd expect it to stimulate her appetite or cause the weight distribution problems of systemic steroids. And so I'd be more concerned it's related to the diabetes or to something else than to the Advair. If the Advair is necessary, it should continue.
Yeah, I think it's related. Also, if you're breathing better now, you feel better, it might be that you're gaining weight because you're weller.
It's possible.
Here is an Aberdeen question. Can Spiriva and Advair be taken at the same time?
Yeah, in fact, they're indicated in some instances. Spiriva, we didn't talk much about that prior, is a long-acting muscarinic agonist. Or antagonist, sorry. It opens up the lungs and makes it easier to breathe. It's not an anti-inflammatory per se, and it's indicated for patients with COPD who have persistent symptoms or more than mild disease. And when used with Advair in the right population, those patients with COPD who have more severe disease, it improves the effect of both the Advair and the Spiriva. So they work synergistically.
Yeah, now Spiriva, does that dry out the lungs? Is that a good thing?
Yeah, it can. Yeah, so it can reduce mucus secretion in the lungs. Right. Now, it can have that side effect on the eyes and the mouth and things too, so you have to be aware of that potential.
And there's new Spiriva-like drugs. Are they any better?
Yeah, there's one called Tudorza that's out now. It's twice a day. It's equivalent, I would say. They would tell you that perhaps it gives an extra boost because you use a second dose in the evening, but they're very similar. They're both very good drugs and indicated for COPD patients.
And here's a question from Rapid City. How does chemo affect the lungs?
Yeah, a variety of different ways. So again, chemotherapy drugs, yeah, they can all have negative impacts on the lungs, but they're necessary in most instances to treat your cancer. So make sure if you have lung problems, a breathing test before you start chemo, and then we can track whether it's causing damage. Sometimes it's an acute reaction where you're very sick with a pneumonia-like illness from the chemo. Other times it's a toxicity, and then of course chemo suppresses your immune system. So many patients get pneumonia from chemo as a consequence of chemo, and oftentimes, unfortunately, die prematurely because of that complication. So it's very important not to get sick when you're on chemo.
And carefully monitor your breathing.
If you get sick, to get in right away.
Yeah, yep. My father has COPD and has been treatment for several years. What medication, newer drugs are helpful? When there is a sudden change of increased shortness of breath, what are the possible causes?
Yeah, so COPD again, there are maintenance inhalers that every patient should be on based upon their stage of disease, which is established by an interview with your physician and a breathing test. And that will help guide the physician using those GOLD criteria. They're out there for all of us to decide what he should or shouldn't be on.
Pulmonary function test, very important there.
They're absolutely necessary. And that can also allow us to follow the disease progress. When symptoms are more acute, it's usually an infectious cause.
Yeah.
And it's hard to differentiate whether it's truly an infection that would respond to an antibiotic or one that's viral and doesn't need an antibiotic. And we don't have an easy test for that.
So there's a quick change we got to get in.
That's the key thing. And then steroids are often important in that setting too.
Probably
just a short course of steroids. A study just came
with
out.
Antibiotics.
Yeah, in some instances.
50 milligrams for 5 days.
You only need 5 days, the latest study indicates.
Yeah, I saw that. Hartford, South Dakota, how does marijuana compare to tobacco in regards to risks and benefits?
It's a great question because we're seeing an increased push towards legalizing the use of marijuana
how do you
and
feel
smoking
about
it. Well, I think that it could potentially lead to increast difficulties with marijuana-induced lung problems. So burning marijuana, we don't have as much data about it because not as many people smoke as marijuana has do conventional cigarettes. But there's not a filter there, not that filters are effective in any way, but it's not safe for your lungs. We don't know how to compare it to cigarette smoke.
Right, so potentially if it starts to spread, it's going to be a source for lung disease.
I'm certain it will be an issue.
Me too. 2 puffs of Ventolin and 1 puff of Q-Bar.
Yeah.
Is this too much? What is Q-Bar?
Q-Bar is an inhaled steroid.
Q-Bar.
Yep, Q-Bar. Yep, Q-Bar is one of the inhaled steroids.
And actually one of the best drugs we have, and it's the cheapest of the
inexpensive
steroids.
as compared to the others. And
Q-Bar.
so Q-Bar, and it can be dosed a variety of ways, and depending upon your symptom control, it's the key to controlling. So the Ventolin 2 puffs isn't something that should be done every day. That's an improper way to use that medication, improper way. So the Ventolin 2 puffs is the right dose, and some use 4, but it's only a rescue inhaler. Ventolin's albuterol. So the Q-Bar should be used every day, however many puffs your doctor recommends, however many times a day, sometimes once, sometimes twice. The Ventolin shouldn't be a scheduled medicine.
Right.
It's
You would prefer a combination of a Ventolin, like long-acting Ventolin.
Potentially, or just increasing the Q-Bar dose.
Right.
So.
Okay, so we love Q-Bar. We're not happy about albuterol, but in combination with the steroid, it's probably safer.
Albuterol is critical for rescue use. It's not a maintenance inhaler. Right. So albuterol, everybody with asthma needs an albuterol inhaler, but hopefully their symptoms are controlled and they're not needing it. It's their rescue agent. It's not a maintenance therapy.
All right, now Symbicort, like Advair and like, what's the other?
Dulera.
Dulera and Spiriva, why are they taking both? I have COPD. And again, somebody asked about the maximum
Advair.
best treatment for COPD. There it is.
It's both, right? And again, it's critical to have that breathing test to know where you stand and to visit with your physician about symptoms so where you know whether you need to be on both or one alone would be enough.
How do you know the difference in lung conditions? Do you look at x-rays or what? What's the difference?
It's a combination. So, most of the time the symptoms are similar, although there are subtle differentiations. So history is critical. Secondly, sometimes imaging studies are very beneficial. They rule out things and sometimes make diagnoses. But again, the key component is that breathing test. That's what separates the pulmonary function test. That's what separates restriction from obstruction, from perfusion deficits or diffusion deficits, I should say, or other conditions.
And I'm going to say this. This is I'm an old guy.
Yeah.
Stethoscope.
Yeah.
You hear crackles. You got restrictive to lung disease. You got wheezes. You listen to the length of time.
Yeah. And I'd take it further. You put your hands on their chest and feel for what we call fremitus, and you listen for egophony, and you percuss the chest to determine if there's dullness or hyperresonance to percussion. All of those things are critical.
Very important. Has sinus congestion, what can be done?
Yeah, so again, sinus congestion is a common complaint, and the steroid nasal sprays we mentioned earlier are available readily by prescription or now over the counter, and they don't work the same day. They're not like the ones that you get addicted to. Right? Some of my patients, right? Afrin, Nasal 4, any of these over-the-counter ones that immediately decongest your sinuses, they're bad because you become dependent upon them. So the steroid nasal spray needs to be used faithfully, and over a period of 3 to 5 days will start to have its effects. It will reduce congestion, it will reduce nasal drip and drainage, it can control some other allergy symptoms as well.
Very important. And over weeks it gets better and better and better.
And you can use it continuously without concern of becoming addicted.
Don't drink too much water, but got gout and told to drink 3 liters of water.
Yeah.
What do you think of that?
Yeah, you got to balance it out, right?
Okay.
So,
kidney stones, gout.
Yeah, so I mean, gout is a condition of uric acid excess in most instances, and it's important to recognize other comorbidities, other illnesses associated with it. Diet's important, and certainly adequate hydration. 3 liters might be excessive if he has a bad heart or bad kidneys otherwise. Right. So it's a matter of what's right for each patient.
There you go. It's a balance. We talked about less water. Now we're saying we need to, well, in this guy, you would have to have a little bit more water, but probably if you're having gout, it isn't the water. You need allopurinol.
Yeah, it's either that issue or something else you're doing with your diet, or potentially, and there's other treatments other than allopurinol.
Yeah, besides allopurinol. Belle Fouche. Want docs to talk about nicotine gum after quitting. Is it safe?
Yeah, so nicotine replacement therapy, it's safe in most instances, unless you have significant ischemic heart disease or hypertension where it's not safe. And it can be used as a crutch while you're getting through stopping smoking. So instead of going to the cigarette, I encourage people to go to the nicotine gum. I don't tell them to chew nicotine gum all day. So the way that I use it is a patient on Chantix or Zyban or the nicotine patch who then has a craving and wants to go to the cigarette, I ask them to go to the gum instead. Use the gum like the cigarette. When they're done, 3 minutes, 5 minutes, spit the gum out.
Okay.
It's their nicotine. It's safe in almost every instance. Now, it doesn't break the cycle of the dependency on nicotine, but it gets them away from the harmful effects of the cigarette smoking.
And a lot of people say it's the carbon monoxide poisoning and the toxins in the smoke.
Certainly, yes.
It isn't necessarily the nicotine.
Nicotine's the addictive agent, and it's strongly addictive. Some people, the first time they have nicotine, become addicted to it. They want more nicotine, and so that's what keeps you coming back to the cigarette. It's the burning of the cigarette and all the chemicals that are added to idealize the delivery of the nicotine through the lungs that cause the cancers, the COPD and emphysema, the need for oxygen, the shortness of breath, all of the heart disease, the vascular injury, all the bad things associated with smoking.
And we don't want our kids addicted to the e-cigarettes because it's going to be really addictive. They're not going to be able to stop the e-cigarettes, even though they're safer probably to the lung.
The problem is they don't help people stop. So if you're not smoking already, the e-cigarette's just another chance to get exposed to nicotine. If you are smoking and you start smoking the e-cigarette, you're just as likely to continue smoking conventionally as you are the e-cigarettes. So and they probably have their own harmful effects.
Okay. And the last question, as what's his name used to say, Jimmy, John, yes. Why don't doctors recommend e-cigarettes to quit? And there we have.
That's
we
exactly
just
the
finished
reason. Yep. And I think it's a question that we're going to see a lot of people ask. And if you look, and this is just for whoever's listening, but there are some proponents of it that have come out and said, for my worst cases of smoking, I think an e-cigarette's a good alternative. The problem is we're not proving that those people go away from regular smoking to strictly using the e-cigarette. Right. Probably would be better for them, but it doesn't work.
Right. Take-home message, final last words, Mike.
Well, I guess what keeps resonating in my mind, besides stop smoking if you are or ask for help, is if you have chronic lung problems and your doctor wants you to be active, it's critical that you're active. So you're going to be short of breath. And I tell my patients with lung disease, I want them to be short of breath. Now that sounds sort of cruel and inhumane, but that means they're doing things. Yeah. My patients who come in and say, I'm never short of breath, are the ones who are in the biggest trouble because they're sitting in the chair doing nothing. Yeah. So my chronic lung patients need to be active. And one other thing I'll pitch is pulmonary rehab. It's very clearly beneficial in the right subset of patients to go through that program. And it's covered by Medicare. And I can't emphasize enough that our communities need to support it more, and patients need to be offered that opportunity. Can't be smoking, and you have to have a certain degree of lung dysfunction demonstrated on a breathing test, but if you qualify, it's of great benefit.
Great. Well, we truly thank you for joining us and for bringing your wonderful expertise to this show.
Thanks for having me.
And thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time, and call in or email your questions. Until next time, stay healthy out there, people.